Are you a woman in your 40s and 50s who feels tired, moody, or has a racing mind, and no matter what you try, you just cannot sleep through the night? You may think it's just your hormones or getting older, but here's the truth. It could be something else like obstructive sleep apnea or a breathing condition when you sleep. The best part, treating it can completely change your health. Hi, I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert. I've helped thousands of women in over 12 years of clinical sleep medicine improve their sleep quality and overall health. So here's what happens when women over 40 treat their obstructive sleep apnea. Their blood pressure can improve, which can lower your risk for heart disease. Your energy, your memory, and mood can also get better. Night sweats and hot flashes and broken sleep often calm down, and you can even cut your risk for diabetes, stroke, and an early death. So let's break this down a little bit deeper. Number one, your heart health. After menopause, women lose some of the natural heart protection from estrogen. And that's why heart disease still is the #1 killer for women in the United States. And this isn't something to brush off. If you already have high blood pressure or an irregular heartbeat like atrial fibrillation, please ask your doctor about getting a sleep study. Think of your heart like a car engine. If you drive all night without rest, the engine overheats and wears out faster. And that's what obstructive sleep apnea that goes untreated can do to your heart. When you stop breathing, your oxygen levels drop and your heart rate races to keep up. Over time, that extra stress really can damage it, but with CPAP machines or other treatment options, your heart can finally get the rest it needs and recover. Number two, your metabolism and weight. Sleep apnea also can affect your metabolism, believe it or not. It can make your body less sensitive to insulin, which raises your risk for diabetes if it doesn't work well. When you don't sleep well, your hormones that control your hunger and fullness really get mixed up. Those are called leptin and ghrelin. That's why you can crave sugar and carbs more the next day if you didn't sleep well. I've had patients tell me, once my sleep apnea is treated, I wasn't living at the bottom of a bag of cookies anymore. And their cravings just eased up. Their energy improved, and for the first time, they actually were able to lose weight without extreme dieting. And I think one of the biggest parts is they had more energy to cook healthy foods and go to the gym. Number three, your brain and your mood. So many women in their 40s and 50s tell me, I just don't feel like myself. I'm foggy, I'm tired, I'm snapping at everyone, and obstructive sleep apnea may be the missing piece. Here's why. Deep sleep, also called stage 3 sleep, is when your brain turns on its cleaning system. It's like your brain's overnight housekeeping crew, sweeping away the waste and toxins that get built up during the daytime. And if you're not getting enough deep sleep because interruptions in your breathing keep waking you up, that cleanup never happens. And over the years, this actually can increase your risk for memory loss and dementia. Let's also talk about mood. Poor sleep can make anyone cranky, but untreated obstructive sleep apnea can make depression and anxiety even worse. I've had patients come back tell me after starting treatment, they say they feel like a new person, and their families can even notice a difference. They're calmer, they feel more joyful, and are more present. Number four, menopausal symptoms. Here's something that most people don't know. Sleep apnea can actually trigger hot flashes and night sweats. So if you're waking up drenched, it may not just be menopause. It could be sleep apnea that's adding fuel to the fire. The good news is once your sleep apnea is treated, those wake-ups often settle down and you finally can get into that deeper, refreshing sleep that your body has been craving. Number five, quality of life and longevity. This is what it's all about, feeling good again. Treating your obstructive sleep apnea can mean no more morning headaches, more energy for your kids and grandkids, and better focus at work. Many women tell me that their intimacy also can improve because they're not so tired all the time. And beyond daily life, treating your obstructive sleep apnea can protect you from one of the biggest threats: stroke, heart disease, or even early death. It's not just about living longer, it's about living better. Here's the bottom line. If you're a woman in your 40s or 50s and you've been struggling with poor sleep, exhaustion, mood changes, don't just assume it's your hormones, aging, or stress. Please get tested, ladies. Get treated and take back your energy, your clarity, and your overall health. If this video helped you, please hit the like button, subscribe for more sleep tips, and if you want to learn more about women's sleep health and whole living, please consider joining the Sleephoria Sisterhood. It's a free community. Link is below. Until next time, sleep well.